these are typical traits, and that many of us suffer from. We live a high-stress life. We tend to be very sedentary. You know that you want to commit to the whole food diet or the fast diet, but you quite often find that you are in a rush and you choose fast food rather than whole food. You know that you'd rather take that juicy steak off the grill and enjoy that before you would your fruits and vegetables. Is your sedentary lifestyle leading to being overweight? Are you sleep deprived? Do you have sleep apnea? Are you struggling to make it to bed before midnight? I know a lot of my patients don't. I know sometimes I don't. Are you perimenopausal? Are you andropausal? Does anybody know what andropause is? A man. Okay, she starts. Anybody else? Any ideas? So it's actually the decline of male hormones, namely testosterone, DHEA, and even your thyroid. So women go through perimenopause and menopause. We talk all about that. That's very commonly discussed amongst women and men. But actually male hormones also decline as we age. Smoking is a powerful cause of inflammation. Sun worshiping, over tanning, and then the other disease also that I will go into more detail about is periodontal disease. How is that related to inflammation? What is the connection? These are all chronic diseases that I've listed here, and they make up the majority of aging-related diseases in the United States. In 2005, the Annals of Family Medicine predicted that it is estimated there's 57 million Americans who suffer from these type of chronic diseases. And that was in 2000. It is estimated that 81 million individuals will be suffering from these type of chronic diseases. Many of them, or I would say all of them, are preventable by 2020. So 81 million individuals will have this or more disease by 2020. They all have a common underlying cause. And it's inflammation. The study of inflammation has evolved over the last few decades. At one time, we thought each disease process had a different cause, but we are finding as we're studying more and more in depth about inflammatory markers, genotypes, and how the environment affects turning our genes on and off, that there are often common reasons to why we have inflammation in our body. What are some of the biological pathways of aging? You can have free radicals, you can have glycation. This is an important word to remember as we go to the topic of sugar. You can have methylation, you can have neuroendocrine decline, you can have DNA damage, also known as epigenetics or the mutation of genes, and you can have longevity genes. And I'll talk about that in a minute. The last one is inflammation. All of these are well known to cause rapidly aging individuals, or if you're lucky and if you have good genes, you may live a longer life. So why do we actually have inflammation? What's the reason that it's important for us? It's actually a response to injury, illness, or infection. So when you were a caveman at one time and you were outdoors, if you were bit by a snake, what message would that send you? It would immediately stop the bleeding, which means the venom would not spread throughout your body. It would fight infection that was introduced by that snake bite, and the pain would remind you, don't play with snakes. So why do we need inflammation? I just discussed that. There is a dark side to inflammation, and it actually can be silent inflammation. It's your principal line of defense. It helps you repair damaged tissue. So why is it one of the deadliest diseases, and why are doctors working so hard to stop you from having inflammation? So what's changed? Our DNA has not changed. Our conditions and lifestyles, those have definitely changed. We are probably more sedentary in front of our iPad and in front of our iPhone than we have at any time, I think, in centuries. So now it's working. There we go. So another, what else has changed is our food sourcing. We tend to eat more refined processed foods in excess. We actually suffer from more adrenal fatigue. The adrenal gland releases cortisol, and cortisol is perceived as a fight or flight hormone in your body. So as you were coming here and you knew you were going to be late for this lecture, you were releasing cortisol. As you're releasing cortisol, that's perceived as a threat. So any food that you might eat while you're secreting a lot of cortisol will go away and be stored as fat. So it's a fight or flight hormone. It sends a message to your body that you need to save that energy for future, because you never know when the next meal is going to be coming around the corner. We rarely suffer from infections, and nowadays with modern medicine, trauma medicine, and surgeries, that's probably one of the best things that Western medicine has given us. What about epigenetics? This is one of the newer sciences that is coming out, and it's actually talking about the biological mechanisms of how do we switch our genes on and off. So 20 years ago when I was in medical school, or 25 years ago when I was in medical school, I was actually taught that the genes that you get are the genes that are going to manifest. That's it. So what you get is what you get. You know, unlucky you if you have this particular gene in your body. More and more study and research is showing that actually there are ways to actually turn on and off genes. We've known about this in cancer genes for decades. Doctors have been studying, why do cancer genes turn on? What promotes it? Now we're finding that what turns on the genes for perhaps other diseases such as diabetes, Alzheimer's, and other chronic diseases. This particular subject is called epigenetics, and it is the different combinations of genes that are turned on and off and what makes each one of us unique. Epigenetics is everywhere. What you eat, where you live, how you interact with individuals, how you sleep, how you exercise, even aging influences your genes. One of the hallmark studies of epigenetics, if you guys want to research this, was done by Dr. Dean Ornish from Harvard Medical School. He was actually studying cardiovascular disease, and what he found that
There's a seat over on the left. Okay.
what Dr. Dean Ornish found is that he was trying to put individuals on vegan diets and get them to lose weight and reverse cardiovascular disease. His urology colleagues, in the meantime, in JAMA article of 2009, found out that prostate cancer genes were being turned off while Dr. Dean Ornish's patients were on the vegan or vegetarian diet. So that was one of the hallmark studies showing that you can actually turn genes on and off, oncogenes, prostate cancer genes, while he was actually working in the cardiovascular field. Epigenetics is reversible. With 20,000 genes, what will be the result of the different combinations of genes that are being turned on and off? So our goal as we move forward is, what genes can we keep on that promote health, and what genes can we keep off that promote bad inflammatory diseases? So the secret is out. Chronic inflammation kills. It can destroy nerve cells, it can destabilize cholesterol deposit, it can depress your immune function, it can promote formations of cancer, and it can activate harmful genes. Chronic inflammation exists below perceived pain thresholds. What are some of the mechanisms of silent inflammation? Hormonal imbalances, glycation. Glycation is when an individual cannot process sugar correctly, and the excess sugar in one's body actually connects proteins in irregular formations and causes inflammation. I talked to you about the stress hormones. Some of the stress hormones that are released: cortisol, insulin, and pro-inflammatory eicosanoids. So you can see that there's different types of eicosanoids. There's pro-inflammatory and anti-inflammatory. Unfortunately, with our sedentary lifestyle and the foods that we eat, we tend to turn on the pro-inflammatory eicosanoids rather than the anti-inflammatory. Also, there are dangerous cytokines. There is nuclear factor kappa beta, there's tumor necrosis factor alpha, interleukin 6, and interleukin beta 1, and interleukin 8.
Seat left on the left. Okay. Go ahead. Over there.
Nuclear
Right there.
factor kappa beta is particularly interesting, is that it can control the turning on of bad or good genes, and it can promote the immortality of certain cells, that is, to turn cells into cancer type cells. So how do you start the fire? What can promote inflammation? We talked about genetics. You can turn on genes on and off depending on your lifestyle and the foods that you eat and how you decide to live your life. Some of the habits, such as smoking, can also start inflammation. The amount of stress that you experience in life. Are you low on your estrogen, testosterone? And then there's periodontal disease. And then there's a sedentary couch potato lifestyle that we lead. And then there's the foods that we eat. These can all start the fire that we call inflammation. This is a particular journal article that I want to point out. For ages, doctors have been practicing medicine and dentists have been practicing medicine, and we're really busy in our life doing the things that we do best. However, as early as 2007, this is a New England Journal article that shows the link between periodontitis and cardiovascular disease. In this particular article, 120 patients were randomized to be treated for severe periodontitis with just traditional care or aggressive care. And endothelial function, which is the lining inside of your arteries, and inflammation was being measured on days 1, 7, 30, 60, and 180 days. The conclusion of that article, which is 10 years old by the way, noted that there is increased levels of inflammation markers, CRP, fibrinogen, and cytokines. Those are all big words, but these are common inflammatory markers that a physician might measure on an individual. It showed that periodontal pathogens in vitro can promote platelet aggregation and foam cell formation. Foam cell formation actually is not a good thing. It ends up creating more plaque and more artery occlusion. In clinical trials, the presence of periodontal bacteria and periodontitis has been associated with carotid intimal thickening. And I'll talk about that in a minute and show you what carotid intimal medial thickening is. So there is a link, and it has been known for a decade that periodontitis has a role in chronic infection and inflammatory diseases, which can increase your risk of heart attack and stroke. This is one of the latest oral disease inflammation articles showing high-risk periodontal pathogens contribute to the pathogenesis of atherosclerosis. Dr. Nader, did you want to talk about that briefly?
I mean, Dr. Brad Bale and Dr. Doneen are physicians that I've known for the past 5 years or so. And this is a publication that was submitted to the New England Journal as well. And what has happened from this journal is they've been getting a lot of attention across the country, and that they were the first to really show that, you know, if you have bad bacteria in your mouth and you leave it untreated, it is going to cause inflammation. And they actually listed the different pathways of how those bad bacteria can lead to plaque formation in the arteries. The arteries that we worry about, the arteries of the heart, the arteries of the brain, you can get a heart attack, you can get a stroke. And this, unfortunately, we see day in, day out. This is the disease that we treat on a daily basis in our offices. And so when we look at things, when I look at a patient, I'm not looking just at a tooth or the gums, I'm looking at the whole picture, family history. I'm looking at, have there been any event, did you already have a heart attack? What can I do not to prevent it? I don't want you to get another one. So I'm going to do everything possible in my office to make sure that we decrease inflammation and make sure that our job makes it easier for Dr. Hakim to really treat her patients and do her job correctly. Without having both of us working together, there is no way that I can do my job properly, and neither can she.
One of the greatest analogies Dr. Nader and Rima taught me is they asked me that if I saw a sore on somebody's body, the surface area of my hand, would I get worried about it? Would I treat it? And I said, you bet I would. I would put that person on antibiotics or antibiotic cream, and I would take care of it because that's an entry for infection. And he said it so aptly. He said, well, when a person suffers from chronic oral disease, that's the surface area that's inflamed. So that is going to introduce tremendous amounts of bacteria into the bloodstream. And we've known for years that it might go to your valves and cause endocarditis, but now we're finding more and more links, knowing that it can actually promote more and more cardiovascular disease, heart attack, and stroke. So what about obesity and inflammation? Many people think that obesity or the fat cells are just that, they're storage units. But in reality, more and more research is showing that fat cells actually do release inflammatory markers. What about your hormones? What happens as you lose your estrogen as you age? It increases inflammatory cytokines such as IL-1, IL-6, tumor necrosis factor. What about low testosterone? It increases tumor necrosis factor, IL-6, C-reactive protein. As tumor necrosis factor decreases, there's a decrease in nitric, as it increases, there's a decrease in nitric oxide production. I'm lucky enough to have a wonderful doctor here, Dr. Hai in the back, who has been a urologist for how many decades?
40.
40 years. He's a dear friend of mine who would also, who could probably do an entire lecture on low testosterone. So just to let you know that there are a lot of experts in this room who probably have a lot of knowledge in different areas, but this is just a quick overview of how your hormones affect you. Low thyroid is correlated with high C-reactive protein, and it can lead to metabolic syndrome. Metabolic syndrome is overweight, pre-diabetes, and hypertension. Low DHEA, which is a precursor to cortisol, can also increase your C-reactive protein. Growth hormone, which is another well-known area, it can correlate with increased homocysteine, it can increase fat deposition, and it can increase endothelial dysfunction, which is inflammation, and lead to more cardiac deaths. Hormone elevations resulting in increased inflammation is having high cortisol, the fight or flight hormone, having high insulin levels. So if you're not quite sure, you can have your doctor do a fasting insulin level. Fasting insulin levels can correlate with an individual who does not have the ability to process sugar appropriately, and this too will increase tumor necrosis factor and interleukins. What about your diet and inflammation? Everybody talks about omega-3s and omega-6s. What do we need? We actually need a 1-to-1 ratio or a 2-to-1 ratio. A danger zone is when your ratio is 4-to-1, that is omega-6 to omega-3. The typical American diet, we're consuming about 20 times more omega-6s than we are omega-3s. We overproduce pro-inflammatory hormones. This is a quick, I won't spend too much time on this, but this is how omega-6 gets metabolized in your body. Linoleic acid comes from corn flour, safflower, sunflower oil, and then it goes down the pathway into arachidonic acid, which can be inflammatory. But what can block it? Simple things like magnesium, zinc, B6 deficiency, high cholesterol diets, alcohol, and aging can block that pathway. These end up leading to more pro-inflammatory markers. Also, having high insulin, sugar, and high glycemic foods will also lead to more pro-inflammatory. If you take fish oil, which is EPA and DHA, you can actually push the pathway towards the anti-inflammatory pathway. Omega-3s, which is typically known as fish oil, also can come from flaxseed oil. And how do we block that pathway? We can block that pathway with, again, magnesium, the lack of magnesium, the lack of zinc, B6 deficiency, and high cholesterol, alcohol, and aging. And these two pathways will lead you to more anti-inflammation. So that's why everybody should consider some sort of omega-3 on a regular basis. Omega-3 fatty acids in the cardiovascular realm are known to inhibit coagulation, promotes vasodilation, reduces inflammation, modifies lipid concentrations, reduces your triglycerides, which could be one of the type of numbers that your doctor may talk to you about, and it reduces stroke by 0.72, by 72%. It reduces the risk for thrombotic infarction by 67%. This is glycation. This is sugar. This was an article that I received in November talking about the addiction that we have to sugar. They've actually done studies on mice and rats where they have sugar in one corner and cocaine in the other corner, and the mice and the rats actually go back for the sugar rather than the cocaine. So glycation, which I talked about, is when you overcook food and it results in glycotoxins. Most junk foods are high in glycotoxins, and this can be a normal aging process. It induces low-grade chronic inflammation. High glycemic foods produce insulin surges and contribute to chronic inflammation. Once you have glycation, it's irreversible. This is a YouTube video that I'll show you guys later. I'm going to move on because we'll do another YouTube video in a second. So I just wanted to take a break because I probably passed on a lot of information. If each of you guys, I want to do a little sugar experiment. I want you to just pass this behind to, and I don't want you to eat any of it just yet. I want to make sure everybody got enough. If not, raise your hand.
That's all. Go back. Make sure everybody has one.
Did anybody miss one?
Does anybody not have one?
Just one here. I got one.
You got one? All right. Everybody just take one M&M out and just roll it on your tongue. Yep, there you go. And I just want you to enjoy it. So the reason we're going to do this, we're going to do a little experiment. Because everybody talks about how difficult it is to block sugar and I can't stop eating it and, you know, there's just got to be a way. And I mean, there are no incurable diseases, there's only the lack of will. This was read by Abyssinia, this was said by Abyssinia hundreds of years ago. There are no worthless herbs, there is the only lack of knowledge. So everybody enjoy your M&M for a moment, and then inside there you will find a little tablet. And it's not dangerous, it's an herb. So what you have in front of you is called gymnema. It's a native herb to southern and central India and Sri Lanka, and it's known as the sugar destroyer. So if you just pop that in your mouth and let it roll on your tongue, don't swallow it, just let it roll on your tongue. And it's gonna be a little bit woodsy. It's gonna have, you know, it's not gonna be the best tasting thing, but just roll it on your tongue for just 30 seconds. And then if you wanna spit it out, you can spit it out or you can swallow it. So now what I want you to do is take that second M&M and put it on your tongue. Does anybody know just the difference?
Does it taste sweet?
Isn't that amazing? So you will see that diabetic patients that have been taking this medication, this is an Ayurvedic herb, actually commonly used in India. Studies have shown that diabetic patients taking oral medications could reduce their blood sugar levels by taking 400 milligrams of gymnema sylvestrate daily. You can get this at the vitamin shop. You can get this anywhere.
Do you have to suck it like this, or can you just swallow it?
You can just swallow it.
Okay.
Yeah. I mean, if you're having a sugar craving, but you know, quite often a lot of my individuals say, "Gosh, right after a meal, I have such an urge to have a piece of chocolate." I mean, sure, if you want to have a dark piece of chocolate, if you want to go a step further, I'm going to tell you to roll it on your tongue, and it literally within a month, if you take this on a regular basis, you will lose your sugar cravings.
So it doesn't have to be just before you have the sweet?
No, no. Because one of the, some of the research also is showing that it actually does help promote the pancreas to help insulin stick around or flow in the bloodstream longer. So it is actually helpful for the pancreas to have this on board. This is not, you know, quite often here in the West we use metformin. Metformin is used for that purpose as well. What I like about this one is that it's a natural herb. Metformin actually comes from the French lily plant, so it actually does have a natural origin. What's neat about this is it takes away the sugar craving, and if you're one of those people who really have a sweet tooth, just roll it on your tongue for a few minutes.
So for like insulin resistance and the metabolic disorder you're talking about, this would help.
Yeah.
Does
And
it
you can
cause
take-
low blood sugar at all? Like, is there a side effect to it at all? Like
No,
you
not
would
at 400 milligrams. They found in the studies that there were no individuals who reported hypoglycemia. By the way, I do have some patients on it with metformin. They do great.
I
Again.
give those to my children too.
Oh,
Once in a while.
okay. She does it with her pediatric. Good. I haven't, I can't comment
When
about
they have
pediatric.
like a party or something, I give a little bit.
Hershey's-
To avoid the surge after. Maybe not that much.
So, For a physician such as myself, how do I screen for inflammation? I ask individuals about signs and symptoms, family history, very important, early heart disease, early heart attack and stroke. Does diabetes run in your family? Evaluation would be a thorough history and physical, fitness, nutrition. How much stress do you have in your life? What's your cognitive function like? And then I'll talk about age biomarkers and cancer screening. That would be typical. Some advanced laboratory testing that I like to do on my patients is C-reactive protein, homocysteine. I will even do omega-3, omega-6, which is the arachidonic acid EPA ratios. I will do their hormones, their fasting insulin, thyroid, their DHEA, insulin-like growth factor. If needed, if I think they have a cortisol issue, I'll do fasting AM cortisol. I want you to focus on lipoprotein little a for a second. Just keep that in mind. That's an independent risk factor for heart attack and stroke. Meaning you can have the best looking cholesterol pattern and your cardiologist could say, you're in great shape, go home, enjoy life. Just remember lipoprotein little a. Fibrinogen, which is a precursor to clotting, and then we can even do some advanced testing with some inflammatory markers if needed. So CRP and inflammation. How does C-reactive protein relate to inflammation? It's one of the commonly used tests that we do as physicians. It can be a response to acute inflammation or chronic inflammation. So if you have a cough and a cold and your doctor draws your blood and says, wow, your C-reactive protein is really high, if you're suffering from chronic inflammation or acute inflammation, it's going to come out the same. What you want to do is wait 3 to 4 weeks. If you're feeling better, you go back in, you get your C-reactive protein. If it's still high, then that means there is something underlying. Is it periodontal disease? Is it chronic inflammation in your blood vessels? It's more than just a marker. It can directly predict the future of heart attack and stroke. It can predict your first cardiovascular event even better than LDL, which is a type of cholesterol. So this is a quick chart showing you how CRP can affect the event of a heart attack compared to total cholesterol. So CRP actually is a better predictor than total cholesterol for future heart disease. What about in women? One of the most important things that I'm passionate about is that cardiovascular disease is underdiagnosed and undertreated in women. Quite often, our symptoms are going to be very different than that of a typical male. And you can see right here, men in the light blue, women in the dark blue, C-reactive protein will predict a heart attack, stroke, diabetes. Diabetes is equal, but heart attack and stroke, a C-reactive protein will predict that more so than in men. What about carotid intimal medial thickening, medial testing? When we look at carotid intimal medial testing, we're actually looking at not just plaque formation, and I'll show you a picture of that in a minute, but we're also looking at the thickening of the inner lining of your blood vessel. The CIMT measures 2 important factors, the future of heart attack and strokes. It looks at plaque buildup, which is the accumulation of cholesterol, cellular debris, and bacteria. It looks at the thickening of the inner layer of the carotid vessel and gives me a reflection of systemic inflammation. And this is a very easy test that can be done within 5 or 10 minutes by a good ultrasound tech. This test can be reversible and can reflect a lower chance of future heart attack or stroke. So this is a great picture that I pulled yesterday. You see the 3 layers of the blood vessel? The one that's closest to the red blood cells, which is those little red donuts floating around, that's your intima. And if you look a little bit closer, you're going to see this. And this is the building up of plaque. And you can see how this blood vessel is slowly getting smaller and smaller. The one thing to remember here is that this is a soft plaque, and you'll hear things about calcified plaque. You'll hear about individuals saying, I went and got a CTA scoring, calcium test scoring, from their doctor. CTA scoring is actually looking at a calcified plaque. It's probably a stable plaque that won't rupture. A soft plaque like this is more likely to rupture, and that's the one that causes the acute coronary-vascular disease event and the sudden heart attack. So the CIMT test will actually look for plaque and thickening. This is the arthrogenic triad. This is actually looking at the intima, the media, the externa of a blood vessel, and the beginning of the buildup of what we call a soft plaque. Now, if you have periodontal disease, you're going to start seeing a faster accumulation, and you're going to start seeing the smooth muscle thickening right over here, and that is what's going to create what we call the time bomb. Does anybody know who this is?
No.
You guys don't
From
watch
The Biggest
enough TV.
Loser.
Oh, who's
Bob.
it?
Bob from The Biggest Loser.
Bob from The Biggest Loser. Do you guys know The Biggest Loser TV show? All right. So he looks pretty healthy, right?
Mm-hmm.
So on February the 27th, he was working out in the New York City gym doing his CrossFit. He's one of the healthiest guys. He does videos, talking about healthy eating, so on and so forth. He collapses during his CrossFit video. He's 51 years old. He had one factor that was overlooked, and that was his family history. His mother died of a heart attack at an early age. It turns out that his lipoprotein A, which I mentioned, which is a subtype of a lipid, was elevated in his blood work. This is often inherited, and again, independent risk factor. Nobody could be healthier than this guy. His blood work and everything looked good, but somebody forgot to look a little bit deeper based on his family history. He actually coded. There was 2 doctors in the gym. He was defibrillated twice. He was transported to the hospital. He woke up 2 days later not knowing where he was. So it's more than just looking at your lipid panel. That's what it comes down to. And this was his CNN quote. What about mental decline and inflammation? There's Ronald Reagan. We all know that he eventually was developed and was diagnosed with Alzheimer's. So how do we prevent and treat? We prevent and treat through nutrition, exercise, good oral care, some nutritional supplementation, hormonal balance, lifestyle modifications, stress management, and maybe medications. So the more colorful the fruit that you eat, the variety of fruit, the more whole foods you eat, less likely that you'll have inflammation. What about exercise? So this is Bob Del Monteque, and actually he was the first fitness guru in Hollywood. He took care of like Errol Flynn and individuals from Gone with the Wind. I can't remember all the stars, but he... Clark Gable, thank you. Thank you, Dr. Hyde. And yes, he used testosterone, but you know, he also took care of himself. He ate well, and that's his girlfriend, Nancy Kelly, 75 years old. Bob recently died. I think he was in his late 80s, but he lived a good life. So this brings me to the question, what is the average life expectancy of women in the United States today?
78,
75.
83, 84, right. So the actuaries just came back at 84. Most women go into menopause late 40s, early 50s. So the question is, how do you want to live the last 34 years of your life? Do you want to live like Bob, or do you want to live like some of my other, individuals who don't want to take care of themselves? So it's quality of life. That's what it comes down to. What is the average age of a male living in the United States? 78, 79. Typically andropause, if I'm correct, Dr. High, starts as early as early 40s.
Yeah.
And then it really shows up as you hit your 50s. Yeah. So there you go. So how do you want to spend the next 30 years of your life as a male? 100 years ago, CDC showed that women died at the age of 53 in 1911. So as soon as they hit menopause, they died. Men died 100 years ago at the age of 50. So we didn't have to worry about hormones back then. What about nutritional supplementation? Anti-inflammatory, I talked to you about the importance of consuming fish oil, or if you're a vegan, flaxseed oil in significant amounts. Why is vitamin D3 important? Vitamin D3 has been associated with good bone health. Curcumin, which comes from turmeric. Quercetin, which comes from the skin of, citrus, actually grapes. Grapes, and the darker the fruit, dark apples, meaning red apples. Ginger, bromelain comes from pineapple. Very good. And panthenoic acid, I can't remember what it. Panthenoic acid I can't remember where that comes from. I'll have to look it up again. What about antioxidation? Very important. ACE in the whole, vitamin A, C, and E. Just remember that. Vitamin C, E, K2. K2 synergistically with D3, vitamin D on the prior one, actually develops and stabilizes bone for osteoporosis prevention. Bilberry, grapeseed extract, and green tea extract. Balance and optimizing your hormones, your estrogen, your testosterone, your thyroid, your DHEA. If certain individuals are very ill and have a lot of chronic inflammation, growth hormone might be an option for them. The one thing I want to mention about estrogen, I do bioidentical, I don't do synthetic, because oral synthetic estrogen can raise inflammatory parameters. So you want to be very careful about the type of estrogen that you are given by your physician. So when I go to balance and optimize hormones in my patients, I do it the bioidentical way. I try to restore individuals' levels to that of a healthy 25, 30-year-old male or non-pregnant female. Most often, when women go into perimenopause, you go to your gynecologist and they say, go ahead and start taking birth control. You have 5 years, I'll see you in 5 years, and then you can go through menopause again. Hot flashes, memory loss, fatigue. And actually that stuff is synthetic and it does mimic pregnancy. So you're probably getting about 100 times the amount of estrogen and progesterone that you truly need because it's birth control. But why do they do that? They often do that because you won't complain. You're going to be on it for the next 5 years. Nobody has to follow your serial blood labs, and they don't have to work with you to get you to the optimum amount and the optimum lowest dose that's right for you. And I do regular serum levels on my patients. How about your lifestyle? Coaching individuals and understanding how important it is to get your sleep. What if you have an individual who walks in on 3 different high blood pressure pills? What I was taught was that is sleep apnea until proven otherwise. Avoiding excess sun exposure. What about the fish? We always talk about fish. The higher the fish on the food chain, the more likely it is to have more heavy metals in it, and mercury being the top one. Avoiding fried and processed baked goods, air water pollution. Be careful of the pesticides and herbs that we get exposed to. Treating chronic infections such as periodontal disease, H. pylori, sinusitis, floss daily. The individual who flosses daily, there's been an association that they live 5 years longer.
Wow.
I don't know if, I would imagine that the individual who flosses on a daily basis probably has some pretty good habits. Frequent safe sex, laugh often. And stop stressing and start living. Lila, this one's for you. Because she loves her golden retriever.
I don't let him kiss me on the lip.
All right, she doesn't let him do, but he would if he could. Stress response to management, improve your physical health, control your breathing, meditation, yoga. That's the in thing, but it actually does lower inflammatory markers. Mindfulness, dancing, singing, playing with kids, playing music, playing with your pet. Mix with happy people. Get rid of the toxic people in your life. That's one of the 5, one of the things Dean Ornish has designed is called the spectrum lifestyle. And in one of the key elements he recommends is to get rid of toxic relationships. That's coming from a cardiologist. He's an interventional cardiologist, and he says get rid of your toxic relationships. I think that's pretty powerful. Laugh at the world you live in. Laugh at yourself. Don't take yourself too seriously. This was the 6 recommendations that were given by individuals who were in hospice. Dr. Ira Byock interviewed thousands of dying hospice patients and asked them, what are some of the things that we should really be most concerned about? Being thankful, being forgiving, expressing more love, participating in something bigger than yourself. Don't be too hard on yourself. And remember, pain is inevitable, but misery is optional. That's my favorite line. And these are people who are on their deathbeds. I think they have some wisdom. So, just to cap it off, silent inflammation is a real disease. It's quite often undiagnosed, We don't understand that it's happening, and I like to call it that we often, as physicians, look at the tip of the iceberg, but there's chronic inflammation, that the iceberg is so much, and there's so much more inflammation below the iceberg. Most age-related chronic diseases are needlessly happening, and silent inflammation is a matter of choice. And I will leave you with this quote by a pretty smart man. Thank you.